Turning to video 9, potential indications of melatonin and secretin in children and adolescents, here are two examples of perhaps some of the most studied and most controlled studies in children and adolescents, and there does appear to be a significant signal for melatonin. Secretin, while it has had a fair amount of promise, that promise has not been realized. We'll discuss that in more detail shortly. Melatonin is an endogenous neurohormone synthesized and secreted by the pineal gland and causes drowsiness. Melatonin synthesis and secretion are controlled by the suprachiasmatic nucleus of the hypothalamus, which is synchronized by ambient light so that melatonin production occurs during darkness and is actually inhibited during daylight. Thus, melatonin levels increase rapidly after nightfall, peak in the middle of the night, and decrease towards dawn. While the mechanism of action has yet to be clearly elucidated, melatonin is a potent hormone believed to regulate both circadian and reproductive rhythms. Factors such as genetic regulation, age, diet, and seasonal changes have been demonstrated to affect serum melatonin levels in humans. Potential indications for melatonin: autism spectrum disorder. Sleep disorders affect an estimated 50 to 80% of patients with autism spectrum disorders. Melatonin has been increasingly used to manage sleep disorders in children with ASD. Results from several randomized controlled trials and open-label trials do in fact suggest that melatonin reduces sleep onset delay and extends overall sleep duration in children with ASD. A randomized controlled trial in children with autism spectrum disorder comparing melatonin versus CBT plus melatonin found that melatonin was superior to CBT. However, the most significant improvements across multiple sleep domains were seen in patients receiving both CBT plus melatonin therapy. A review and meta-analysis of 9 studies also noted decreased melatonin levels in patients with ASD, which may result from decreased production of endogenous melatonin that leads to an increased risk for sleep disturbances. However, additional studies have also indicated a positive effect of melatonin in patients with endogenous melatonin levels comparable with controls, which suggests that the effects of exogenous melatonin may extend beyond correcting melatonin deficiencies. Overall, melatonin has clear physiologic rationale and is one of the best studied CAMs for ASD. It's currently recommended as the preferred pharmacotherapy to treat insomnia and sleep issues in children with autism spectrum disorder. Additional research is still required to elucidate the mechanism of action of melatonin supplementation and identify those patients who are most likely to benefit from melatonin treatment. Given its safety and tolerability profile, melatonin is attractive in terms of its use. It's also being used particularly for sleep disturbances in many other childhood onset neuropsychiatric disorders. One of those is ADHD. Estimates regarding the prevalence of sleep disorder in ADHD patients vary widely, but up to 70% of patients with ADHD are estimated to have sleep problems, which range from mild to severe. The specific type of sleep disturbances in ADHD children also varies widely, includes difficulty falling asleep, resistance to sleep, night awakenings, and increased activity during sleep. Treatment of ADHD with stimulant drugs may contribute to sleep disorders. Stimulants have been identified to cause decreased sleep efficiency, delay sleep onset, and shorten overall sleep time by more than 1 hour. However, stimulants do not appear to alter sleep architecture, that is, stage 1 and 2 sleep, slow wave sleep, and REM sleep. There is no current consensus as to how to treat sleep disorders in ADHD, and only low-grade empirical evidence is available. However, melatonin may be an option if insomnia is related to a delayed sleep phase disorder. Results from randomized controlled trials have demonstrated that treatment with 3 to 6 milligrams of melatonin per night significantly reduces sleep onset delay and increases total sleep duration. While more evidence is still needed, melatonin is considered a reasonable, safe, and affordable treatment for children with ADHD who experience delayed sleep phase disorder. Secretin. Secretin is an endogenous gastrointestinal hormone produced in the duodenum that regulates exocrine secretions in the stomach, pancreas, and stimulates flow of bile from the liver to the gallbladder. It also plays a role in water homeostasis and acts as a neuropeptide in the central nervous system. Secretin receptors have been found in the brains of rats and pigs, though its role in the central nervous system is not well understood. Potential indications: autism spectrum disorder. Secretin has actually been well studied as a potential treatment of ASD. Initial anecdotal reports and results from small-scale studies suggested improvement of autism behavioral symptoms. However, evidence from controlled trials examining the effectiveness of intravenous secretin has produced much more equivocal results. A report from the Agency for Healthcare Research and Quality compared 8 trials and found that none demonstrated significant improvements in measures of language, cognition, or autism symptoms compared to placebo. Similarly, a review of 16 clinical trials of IV secretin completed in 900 children with ASD also found no evidence that secretin was effective for ASD. Based on the evidence examined in these reviews, it was concluded that secretin should not be recommended or administered as a treatment for ASD. Key take-home points here. Current evidence suggests that melatonin is effective in reducing sleep onset delay and increasing total sleep duration in pediatric patients with ADHD and/or ASD. Given the safety and tolerability profile of melatonin and limited data with other treatments, melatonin is currently the preferred pharmacotherapy option to treat insomnia and sleep issues in children with ADHD and ASD. Secretin has been well studied as a potential treatment of autism spectrum disorder. However, based on results from current studies, it was concluded that secretin should not be recommended or administered as a treatment for ASD.